When talking to a patient today about treatment options for their anxiety disorder, they were surprised when I brought up several medications that are generally called antidepressants. For example, we were talking about utilizing an SSRI or an SNRI, selective serotonin reuptake inhibitor, or selective serotonin norepinephrine reuptake inhibitor, to treat their anxiety. And they said, Doc, I'm not depressed, I'm anxious, I don't want to go on an antidepressant that doesn't really make any sense. And I said, well, actually, that name depressant is really a misnomer, and I think that it does a great disservice to individuals with anxiety disorders in terms of making them feel that the only medications that they can take for the disorder are medications like benzodiazepines that have a lot of abuse potential, and individuals can become rather physiologically dependent on them and have withdrawal anxiety if they miss a dose or stop taking them. They also have other side effects where they can increase risk for depression, actually, and others. And so when someone takes an SSRI or an SNRI and it works well for them, those medications are actually really great medications for anxiety disorders because they're taken once a day and they provide background protection against that anxiety for many individuals throughout the day. And so you don't have to worry about getting anxious and then what you're going to do once you get anxious. For example, if someone takes an as-needed medication, like, let's just use a benzodiazepine, for example, like Xanax, which is alprazolam, or Klonopin, which is clonazepam, they'll say that they basically, when they start noticing that they're feeling anxious or start noticing they're feeling panicky, then they'll go and find that medication and take it. So they'll often feel really anxious or really in a lot of distress for maybe a half an hour or so until they can find that medication, take it, and then in about 15 or 20 minutes they start to feel better. Well, if someone's taking an SSRI every day, then often they just have that background protection, so they don't have to worry about what they're going to do or if they have a medication with them if they start to feel anxious. There may be a lot of reasons why someone chooses one medication over another if they're going to use pharmacotherapy for their anxiety disorder, and that's one of the reasons why it's so important to talk to a medical or mental health professional about it. SSRIs and SNRIs certainly have their own side effect profile, including suicidality on their warning label or black box warning label for suicidality. And so you really want to make sure that you fully understand the risks and the benefits of choosing one medication over another. But with all that being said, for some individuals, an antidepressant may be the best medication for their anxiety.